Have you ever heard about a disease called Ankylosing spondylitis, or known as AS? It is not just a complicated name, but it is a condition that affects millions worldwide. Assalamualaikum and hi everyone. In this video, my team members and I were going to explain briefly about a disease called Ankylosing spondylitis. But before that, I am going to introduce our team members one by one. Myself, I am ZUHASMIZAN binti IBRAHIM.
Assalamualaikum and hi, my name is SYAIDA ZAHRA binti ZAILUDIN.
Assalamualaikum and hi everyone. My name is NURUL ASYIQIN binti Muhammad SAZALY.
Assalamualaikum and hello. I'm RWABY binti SHAFIEQ.
Assalamualaikum and hi. My name is NURUL AZWANI binti AZIZ.
Assalamualaikum and welcome everyone. Before we go deeper into ankylosing spondylitis, let's first take a moment to understand what ankylosing spondylitis actually is and how it fits within the broader category of related conditions. From the name of the disease itself, ankylosing means stiffening or fusion, spondy refers to the spine, and itis means inflammation. If we delve deeper into the definition of the disease, ankylosing spondylitis is a chronic inflammatory condition that primarily affects the exoskeleton, particularly the spine and the sacroiliac joints, which is the areas where the spine meets the pelvis. AS is the most common condition within the group of spondyloarthritis, which includes a range of inflammatory diseases that primarily affects the joints. As for the types of inflammation under spondyloarthritis, there are two main categories, which are axial spondyloarthritis and peripheral spondyloarthritis. The classification is based on the location of the inflammation. Since we are focusing on inflammation that occurs in axial joints, then AS is classified as an axial spondyloarthritis. AS is considered an autoimmune condition in which the immune system mistakenly targets and damages the axial joints, which is mainly in the sacroiliac joints. This leads to partial or complete fusion and rigidity of the spine, causing chronic back pain, stiffness, and eventually postural changes in individuals.
Next is for the causes and mechanisms of ankylosing spondylitis. Actually, the exact causes of ankylosing spondylitis, or AS, are not fully understood, but studies show that genes and environment may lead to the development of this disease. Firstly is the genetic factors. The strongest genetic associations with AS is the presence of the HLA-B27 gene. This gene present in 90% of individuals with AS. It also possesses unique biochemical properties such as can enhance the potential for misfolding. Secondly, the environmental factors. Viral or bacterial infections such as gastrointestinal or genitourinary infections may trigger AS. This can be due to molecular mimicry, where the immune system reacts to a pathogen that has similarities to the body's own tissues. Other than that is gut microbiota. Some studies suggest that certain bacteria in the intestines may influence immune system activation. Now, let's move on to the mechanism of ankylosing spondylitis. The mechanism of autoimmunity in AS is linked to the misfolding of the HLA-B27 protein within the endoplasmic reticulum. This leads to a state of ER stress. The accumulations of misfolded HLA-B27 in the ER lead to the activation of immune signaling pathway. This ongoing activation of the immune system causes it to mistakenly target joints. This immune dysfunction will eventually lead to chronic inflammation and tissue damage, particularly in the spine and joints. But how does ankylosing spondylitis affect joints? In AS, the body's immune system targets the joints, particularly where ligaments and tendons attached to the bone are also known as entheses. This will lead to enthesitis, which is an inflammation in fibrocartilaginous entheses that causes erosion at the point of contract. Calcification or syndesmophytes will form in response to the scarring. This abnormal bone formation progresses vertically along the spine, lead to the fusion of the vertebrae. And this is what called as an autoimmune disease of ankylosing spondylitis.
Now we move to the symptoms of ankylosing spondylitis. The first symptoms is neck or upper back pain and immobility. In the early stages of ankylosing spondylitis, the lower back is typically affected, but as the disease progresses, inflammation can spread to the cervical spine, which is neck, and cause pain, stiffness, and discomfort in the neck region, which may be worse after periods of inactivity or in the morning. Over time, the inflammation in the cervical spine may lead to a decrease in flexibility, making it difficult to move the head and neck. This can result in limited range of motion when trying to turn the head to the left or right, or looking up and down. Number 2 is stiffness in thoracic, which is at the chest region. In ankylosing spondylitis, inflammation primarily affects the sacroiliac joints and the spine, including the thoracic spine. Over time, this inflammation can lead to stiffness and restricted movement in the upper back and chest region. Stiffness in the thoracic spine can contribute to shortness of breath in ankylosing spondylitis through several mechanisms, mainly involving restriction of chest wall mobility and impaired lung expansion. When the thoracic spine becomes stiff due to inflammation from ankylosing spondylitis, it restricts the movement of the ribs. As a result, the chest wall becomes less flexibility and unable to expand and contract effectively during breathing. Number 3 is inflammatory in lower back pain, which is the most common symptoms of ankylosing spondylitis, which is caused by inflammation of the spinal joints. Inflammatory pain in the lower back pain typically start gradually, often over weeks or months. Unlike mechanical back pain, which is caused by strain or injury, the pain in ankylosing spondylitis begins to worsen progressively over the time. The pain is often felt in the lumbar spine, which is lower back, but can also affect the sacroiliac joints where the spine meets the pelvis, which is commonly involved in ankylosing spondylitis.
Diagnosis for ankylosing spondylitis. Firstly, clinical symptoms such as inflammatory back pain and morning stiffness. Other than that, imaging studies via MRI. MRI can detect early recognition of inflammation, also incorporate both active inflammation and structural damage. Next, laboratory tests. Test for HLA-B27 genetic markers and elevated inflammatory markers like CRP and ESR. Ankylosing spondylitis is challenging to diagnose as the early symptom can be confused with other illness such as psoriatic arthritis and rheumatoid arthritis.
Right now, I am going to explain about the management of the disease. There are two categories: intervention and treatment. You must be wondering, what is intervention and treatment? Intervention is the act of becoming involved in a situation, typically to address a problem or improve conditions, while treatment refers to actions or measures aimed at curing, managing, or reduce the symptoms. So now I'm going to talk about what types of intervention that we can do. Firstly, physiotherapy. This is to reduce disease activity and pain. Not only that, it is also to maintain an optimal mode of delivery. Physiotherapy can help to build some paraspinal muscle and other muscles to help support the spine. Next, exercise programs can improve symptoms. Stretching exercises is one of the examples that patient AS can do. This can also teach patients how to independently handle AS. Lastly, balneotherapy can reduce inflammation due to the warm mineral bath that help relax muscles and reduce stiffness. That includes improve spinal mobility and quality of life. And now, I want to talk about treatment. Treatment is used to decrease inflammatory back pain and improvement functionality. Non-steroidal anti-inflammatory medication (NSAID) are the first therapy. Patients need a high dose of NSAID to help reduce their AS. However, for patients that failed or didn't respond to NSAID, they will be given TNF-alpha inhibitors, that is second-line therapy. Infliximab and adalimumab are the examples.